Hi, today is the Wednesday edition of Case of the Day. We're on our 89th case, and the title is The X-ray Hyposkillia Causing Missed and Misdiagnosis. And while you're seeing this and I'm talking, see if you can spot the abnormality on the first two radiographs of the foot and the spine. This is a patient with trauma and pain. And then the right sided radiograph is a focal lesion. See if you can at least determine whether this is benign or aggressive. And I'll just pause it, or I won't say anything for another 10 seconds, and maybe you can even pause the video to try and understand what's going on. All right. So, three situations, two different patients: fall, pain in foot, lower back, x rays reported normal, so came for MR. Because there was pain, the x rays were done 2 days before the MR. And the MR is very clear. There's a straightforward fracture of the proximal fourth metatarsal metaphysis. In fact, you can see the fracture along this cortex on the sagittal, marrow edema, periosseous edema. So, that's straightforward. If you look at the x-ray, it's actually there. You have periosteal reaction, you have this little bit of callus formation. I think the trauma was about 10 or 12 days prior, so that makes sense. This is an artifact, but this is clearly there, and this should have been picked up. I mean, there's no real reason why not. Then there's an S3 fracture with a buckle, but I don't think in today's universe or day and age anybody would pick up this buckle fracture. So we'll just assume this is a retrospectroscope and leave it at that. Now, this patient was sent to me by a pathologist who was worried about the discrepancy between the MRI and the X-ray report. So this has come through WhatsApp, I assume. And here you see this focal lesion, and I'll just leave it here for a minute. Now this is the MR. It came as an MR knee. So there are 5 sequences, none of which cover the bottom of this lesion. The axial images end somewhere here, and this is what we have. This is what was reported: post-traumatic cystic lesion. First of all, that history of trauma is irrelevant. There was some mild history apparently. Cystic, how do you know this is cystic? You've not given contrast, you don't know. Internal matrix was picked up, very nice. So enchondroma with post-traumatic changes, that's not even an entity. Chondroblastoma, intraosseous ganglion cyst with secondary chondroid metaplasia. I mean, this is like smoking weed, right? I mean, ganglion cyst that has secondary chondroid metaplasia. And low-grade chondrosarcoma. Now, let's unpack this. This is an aggressive lesion. It's osteolytic. There's an irregular periosteal reaction. The cortex is broken. There's an osteoid matrix. And this is all new bone formation and sclerosis. And look at the permeation along the inferior margin. This is an aggressive malignant tumor, period, on the x-ray. And then you have the MR in a 20-year-old. And if you're seeing a little cartilage, then this likely becomes a chondroblastic osteosarcoma, which is what it turned out to be on histopath. And because the pathologist was seeing osteosarcoma, and that was the MR report, I think this was where the discrepancy was. More and more, we're living in a world where no one knows how to read x-rays, especially radiologists. Except some physicians and surgeons whose job it is to read them on the go. So intensivists who read ICU x-rays, rheumatologists who read their rheumat x-rays, pulmonologists for chest x-rays, and orthopedic surgeons for trauma x-rays, orthopedic oncosurgeons who read the bone tumor x-rays, etc. So specialized groups know how to read their specialized x-rays, but the radiologists who are supposed to know how to read x-rays per se, this is what happens. Everything's kind of gone for a toss. And if this is the state of affairs, no wonder AI is coming for us radiologists. It's something to think about, right? This is where we are today. That's the classroom, my WhatsApp channel. Thank you so much for viewing this.